I'm Marthel Neville. Time now for Sunday House Call.
And hello, I'm Eric Shawn. Welcome as always. Joining us is Dr. David Samadi. He's chairman and professor of urology at Lenox Hill Hospital and chief of robotic surgery there.
And good to see you. And Dr. Mark Siegel, professor of medicine at the NYU's Langone Medical Center, also author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health. Hi, doctors.
Great to see you.
Doctors, great to see you.
Nice to see you.
We're not going to cover the presidential campaign with the doctors, but we are going to talk about one kind of issue. Republican candidate Donald Trump made some waves during a town hall appearance this past week after claiming that Michael Jackson's downfall, he said, was due to bad plastic surgery. And that got a lot of people fired up over this. Let's take a look at what Mr. Trump had to say.
I know him very well. I knew the real story of Michael Jackson. He was an unbelievably talented guy. He lost his confidence. And he lost tremendous confidence because of, honestly, bad surgery. He had the worst. He had people that did numbers on him that were just unbelievable.
So how much plastic surgery is too much? Dr. Samadi, you're a surgeon. You know he received it very commonly, and we've seen these cases where people just keep going back and back and back and back.
Eric, plastic surgery is a big business. It's about $10 billion, and it's been growing over the last decade or so. In fact, if you look at the number of liposuction among teenagers between 19-year-old to 30-year-old, 30% of them are getting liposuctions, and that may or may not be necessary. We've seen about 200% growth over the last few years. Why is this happening? So the message to a lot of people and patients is that there's no such thing as a perfect nose and perfect body. And as a result of the media, reality TV shows, Nip and Tuck, and all this other stuff, people want to look like the stars. So they say, okay, I'm going to go and get some Botox during the lunch hour and come back and look great. You have to have a real expectations and not put it so high up. The other thing is also doctors are responsible in this because there are times that people have this disorder, dysmorphic images of their body, and there are times that doctor or plastic surgeon should say, you're a beautiful girl, you absolutely don't need this.
Or guys are getting it too.
Or guys, absolutely. I'm the wrong guy to do this, and you absolutely don't need this. And so that's the key. Now, having said that, I think there are a lot of surgeries, plastic surgeries out there that's absolutely necessary. Somebody who has a real large breast and they have neck pain or back pain, breast reduction is absolutely a great way to go. If you have a deviated septum in your nose, you get sinus infections. If you have webbed fingers, the list is long. For kids, hypospadias, somebody has had mastectomy. We've seen in Angelina Jolie and others, you know, post-reconstruction. Those are great surgeries, and I think when it's necessary, it's absolutely the best thing that can happen. The issue is that as a country, we are having kids that have some psychological issues, that are mental issues, obsession with these surgeries, and you need to know that these are sometimes irreversible. Some of those surgeries that you get may have major complications, bleeding, infections, and really can disfigure your whole body, and it's not necessary.
And I think that is just too casual. The approach to it is casual. I can't believe that you're telling me that 30% of teens are getting liposuction. This is when your body is formulating, your muscles are, you know, kind of retaining memory, etc. Tell me how dangerous this really is, and how do we stop it, Dr. Siegel?
Well, because the first point, and David made this, and Donald Trump made this too, actually, which is the emotional impact of plastic surgery is huge. When your body doesn't look like it did yesterday, it looks different today, you need time to adapt to it. At first, you may be depressed, then you may be euphoric, wow, this looks beautiful, and then over time, it may get worse again. It leads to an emotional cycle, dissociation, where you don't even identify with the new body you have. This is a problem. And as you pointed out, Arthel, with teens, 1/3 of liposuction, where literally you take a cannula and you suck the fat out. Now, the other problem with liposuction, by the way, is the neighboring area may be a problem. In other words, it sucks the fat out of one area. What about the area next to that? People out there may think it's a form of weight loss. It is not a form of weight loss. It only can be used for specific reasons. As an internist, I worry about infection. I worry about scarring afterwards. And again, you can't use it to lose weight.
What do you mean by that? Because everyone thinks you go in and have this procedure done, you just suck out the fat.
Eric,
yeah, but the fat cells
the way to lose weight is to lose weight. If you take lipo, you can lose weight in one area, like a thigh. you know, or a back or an abdomen, but you can't overall lose weight. So you know what ends up happening, Eric? If you lose weight, you get on that treadmill or your diet and you lose weight, then the area you had lipo on looks bad compared to the areas you did it naturally.
Let me just say something also. But there are, for example, someone who is 300, 400 pounds, they get a gastric bypass, and after they lose that 100 pounds, you have this saggy abdomen. So tummy tuck for that person is absolutely perfect, given the fact that you have to interview your surgeon. Find out if this guy is board certified. Is this what he does all the time? Is it done in a setup where you're under control of anesthesia?
And you're talking about something that saves someone's life if you're vastly overweight.
Exactly
that sort of
right.
thing.
But
what about the, just going in and keep on having tweaks after
There's
tweaks
another,
after tweaks?
there's another issue with this, by the way. You talk about saving someone's life with overweight. You know that we have an obesity epidemic, and diabetes is linked to that. You actually cannot have liposuction if you have diabetes or if you have heart disease. That is too much of a risk to have the sudden fluid shift, to have the sudden risks of the surgery.
So
I am not supposed to clear you.
What's your best advice for people who keep on wanting to go back to have, I don't know, something done and something changed and something?
The first
whatever.
thing I want people to realize is that over the past 19 years, we've seen 10 times the amount of these procedures as we had before. And it's even worse with something like Botox, the non-surgical. We're talking about 400,000 cases of lipo, but we have 4 million cases of Botox done. Botox is where you paralyze the muscle.
I think the parents need to pay attention to their kids. They need to make sure that psychologically, if there's an issue, to treat this. A lot of cognitive behavioral therapies works well with these kids, and you can find out if there's any depression or anxiety. Peer pressure in school can affect them. And make sure you don't go to some of these spas that they claim they can do Botox without any certified license. Find a good plastic surgeon, and they can do a really good job. When it's necessary, it's absolutely a great procedure.
Dr. Siegel, one final point, if you
I
can make
started
it
to
quick
say
for
what
me.
Botox is. I want to get back to what Botox is. Botox is where you paralyze the muscle, and in paralyzing the muscle, the wrinkles or the area over it relaxes. The problem with that is that you could overdo that and you could end up paralyzing the neighboring muscle. Then you have a problem with that. I'm not against Botox, but I'm against something David said originally. The point is, why are people doing this out there? You know, they're not all on TV. They're not all models. Not everybody. People have to get comfortable with who they are and not suddenly try to be someone else.
No, that's what I said. I said they watch the reality TV shows.
Exactly.
They want to be like them, and that effect of being a star and Hollywood star makes them think that by just going and get a simple procedure, they're going to look like that.
Exactly.
And has Botox been around long enough to know the results 10 years later?
That's a good point. The long-term effect of Botox is not very clear, and a lot of times people are getting them now, and you may have a major drooping of the eyelids and an effect of this. It's a toxin. What it does, it paralyzes the muscle, and we really don't know what the long-term effect of it is, so you got to be careful.
Wow.
I think Botox, we also have medical uses for Botox, like an unstable bladder, like people have paralysis. Migraines, I think it's very, very useful for. But final point, reiterate something David mentioned. Who's doing this? What's their expertise? How many cases have they done? I mean, he's done over 6,000 robotic surgeries. How many cases has the person done, and who's certifying them?
You have to
People are doing these
doctors.
Botox parties, I'm hearing, at their house.
A what?
A Botox party
It's
where
true.
they get people
They
to come
share,
in.
They share the Botox.
That's insane.